Good part of the day, dear students. This is Aminova Nigina, and today we will be talking about salivary gland pathology. And moving to the next slide, structural elements of the salivary gland unit. Pleomorphic adenomas originate from the intercalated duct cells and myopathical cells. Oncocytic tumors originate from the striated duct cells. Acinous cell tumors originate from the acinic cells, and the last one is they develop in the excretory duct cells. Staging system for major salivary gland cancer. So the first one is TX, is a primary tumor cannot be assessed. Second is T0, no evidence of primary tumor. T1, tumor is smaller than 2 centimeters in greatest dimension. In T2, tumor is 2 to 4 centimeter in greatest dimension, and T3 is 4 to 6, and the T4 is 6 centimeters in great dimensions, respectively. All categories are subdivided. No local extension and with local extension. Local extension is clinical or macroscopic invasion of skin, soft tissue, bone, or nerve. Microscopic evidence alone is not a local extension for classification purposes. The American Joint Commission on Cancer, and you can also see them in the handouts that are given by your lecturers. The normal histology is mucous acini here, the central part, ducts, big cells, and serous acini. They are here the smallest units of the display. So pleomorphic adenoma. Pleomorphic adenoma is in the picture, in the demonstration, you can see them. This is the histopathology, and the pleomorphic adenoma contains both epithelial components and stromal S components in histopathology. Pleomorphic adenoma with epithelial components, tubular and cord-like arrangements. Cells contain a moderate amount of cytoplasm. Mitosis are rare. Stromal, or it is also called mesenchymal components, can be quite variable, attributable to the myoepithelial cells. Most tumors show chondroid differentiation. Osseous metaplasia, not uncommon, relatively hypocellular and composed of pale blue to slightly eosinophilous tissue. Pleomorphic adenoma in histopathology. The diverse microscopic pattern of this lesion is one of its most characteristic features. Islands of cuboidal cells arranged in duct-like structures in a common finding. Loose chondromyxoid stroma, hyalinized connective tissue, cartilage like arrows, and even osseous tissue are observed. This neoplasm is typically encapsulated, although tumor islands may be found within the fibrous capsule. And these are brought in the demonstrations. So Warson's tumor. Warson's tumor, benign papillary cystadenoma, lymphomatosum. So make sure to pronounce them correctly, because these are the terms. The second most common benign tumor of the parotid gland. It accounts for 2 to 10% of all parotid gland tumors. Bilateral in 10% of the cases, may contain mucoid brown fluid in F and A. Warson's tumor is mid-power and thought to arise from salivary gland inclusions within lymph nodes. Epithelial components are: it consists of papillary fronts, which demonstrate 2 layers of oncocytic epithelial cells. Cytoplasm stains deep pink and shows granularity because of an abundance of mitochondria. Occasionally undergoes squamous metaplasia, may mistakenly diagnosed as CC and on FNA. So lymphoid component, an abundance of this is present. Occasional germinal centers will be seen. Lymphoid tissue forms the core of papillary structures. Both lymphoid and oncocytic epithelial elements must be present to diagnose Warthin's tumor. So in high power lymphocytic infiltrates, the bilayer of epithelium could be seen in the under the microscope. So Warthin's tumor, again in the demonstrations, so it looks like a big pink island. Warthin's tumor, electron microscopy shows a tremendous number of mitochondria in the epithelial cells, which are responsible for its granular eosinophilic appearance. Mitochondria-rich oncocytes are found in Warthin's tumor. So this is the monomorphic adenoma, and it is similar to pleomorphic adenoma, except no mesenchymal stromal component, predominantly an epithelial component, more common in minor salivary glands, like in upper lip, and in 20% they are bilateral. Rare malignant potential. Types can be different, like basal cell adenoma, glycogen-rich adenoma, membranous adenoma, clear cell adenoma, and etc. Basal cell adenoma. This is the first type, and a yes, it's the first type, and a monomorphic adenoma is another name for basal cell adenoma. It is composed of uniform basaloid epithelial cells with a monomorphous pattern. The arrangement of tumor cells may be trabecular, tubular, or solid. So let's talk about malignant salivary gland tumors. And this is one type of this ones, and it should contain two components. One is epidermoid and second is mucinous, and it is called mucoepidermoid carcinoma. So here the histology, from histological point of view, the cells under the microscope, and yeah, let's talk about MEC, which is mucoepidermoid carcinoma. It is the most common malignant tumor of the parotid gland and the second most common malignancy of the submandibular and minor salivary glands. Stained by massycramin. MECs constitute approximately 35% of salivary gland malignancy, and 80 to 90% of MECs occur in the parotid gland. Adenoid cystic carcinoma. Adenoid cystic carcinoma with Swiss cheese pattern. So it is the second most common malignant tumor of the salivary glands. ACC is the most common malignant tumor found in the submandibular, sublingual, and minor salivary glands. So adenoid cystic carcinoma. So here you can see a nerve invaded. Where is the mouse? Nerve invaded by adenoid cystic carcinoma, by blue area surrounding the nerve, blue area, right? And spread may occur by emboli along the nerve lymphatics. So here is some other demonstrations. Actinic cell carcinoma. The actinic cell adenocarcinoma occurs mainly in the parotid gland, also known as a blue dot tumor. So demonstration, actually you can see them, the literal blue dot tumor. Classic multicystic pattern stained by PAS. Cells heavily stained. This lesion is characterized by a benign histomorphologic picture, but by occasional malignant behavior. These lesions are treated by surgical excision. Bilateral involvement occurs in 30% of patients, making actinic cell carcinoma, the second most common neoplasm after Wathin's tumor, to exhibit bilateral presentation. Next one is Hodgkin's lymphoma. The disease involves the parotid gland, and you can actually see the needle aspiration in the demonstration. Salivary gland tumors features suggestive of malignancy, induration fixed to overlying skin or mucosa, ulceration of skin or mucosa, rapid growth, short duration pain, and most often it is severe, and facial and palsy. So this is the end of the presentation, and I hope you enjoyed and you learned precise knowledge about tumors and the topic of today's. And let your lecturer know about if you have any questions, and I really wish you luck with your studies. Goodbye, dear students. This is the end.